call to order the special meeting of the Round Lake Area School District 116 Board of Education on Monday, November 28, 2011, the Round Lake High School Theater. May I have a roll call, please?
Mrs. Radford?
Here.
Mr. Eckhart?
Here.
Mr. Daniel?
Here.
Mrs. McGinley? Here. Mr. Williams?
Here.
Mrs. Verdina? Here.
Okay, we would like to take this opportunity to thank all of our community members for coming out, and this is our first of 3 community forums that we are hosting this year. And I'm Connie Collins, superintendent, and just really want to share with you how we're going to proceed tonight. We're going to start with 2 presentations. They will each be about a maximum of 15 minutes each. And then after we have heard the 2 presentations, the first one has to do with facilities, and we will hear from Fanning Howey and Carl Baxmeyer, who is representing Fanning Howey, which is the architectural firm that the district works with. And then we will hear from Brenda Banner. And Brenda is serving as coordinator for School-Based Health Center here in the Round Lake area, and she will sort of share what the work is that has been done to this point. That particular project is in phase 2 of planning, and we'll talk about what the next steps are and why we believe that there is a need for the community. After we have finished with those 2 presentations, I can facilitate, and what we will do is to take any questions, any comments, and have an opportunity to interact with the board. It's not something we're able to do at a regular board meeting, but this is an opportunity for the community members to ask us any questions as well as share any feedback regarding these 2 areas that we have identified for discussion tonight. In March, there will be 2 additional forums that are scheduled. One is on finance, and that one will take place. I don't have the date in front of me, but it is in March. And then the other will be on the area of, tell me that again, Heather? Teaching and learning. Teaching and learning. And so we will continue to share information on those dates, and we hope that we have an opportunity to see you again at those times. So without further ado, I'm going to ask that Carl come forward at this time and share. Thank you for being here.
I hate to stand up there in the shadows. My name is Carl Baxmeyer. I work for Fanning Howey Associates. We're architects, engineers, and planners. And we're fortunate enough to be selected to be your district's architects. And I want to thank the board for this opportunity and Dr. Collins for having us here tonight. I'll be brief. On behalf of Charlie Johnsos, who's our executive director, who she and I are a little challenged, I guess, when it comes to calendars. We had this meeting down for tomorrow night and a meeting in Deerfield for tonight. And we were so happy. We thought, great, we can both go to both meetings. Instead, they were both, unfortunately, tonight. My role at Fanning Howey is I'm the director of our solutions group, which is our planning arm. So I've been working closely with Charlie on putting this together. So I am going to step up here for 1 second to get the little fob here. This process began at the beginning of the year. It's taken a little longer than we had originally envisioned. We had some opportunities to look at some alternatives that may or may not make sense to include, and we had to examine those. But we're at the point now where we're ready to deliver the final report to the board and have them put on the website so people can examine it. Just briefly, probably ask, why put a table of contents up there? We'll put it up there just so you know what elements go into a facility master plan. Obviously, the goals and objectives is a key element, a summary of the facilities. But you really get down to number 4 there, you're starting to get into the meat of things, the facilities assessment. We had teams of architects, engineers, and planners walk through all the buildings, the elementary schools, the 2 middle schools, and the high school, as well as look at the ancillary facilities and do an assessment as to their physical and educational adequacy. We also looked at the academic curriculum. It's important for us to understand and for the public to understand what is being taught, and in the future, one of the goals of the district as far as how is that curriculum going to change. We looked at the non-academic use of schools. The community makes extensive use of a lot of facilities, so it was important to look at that aspect of the buildings. The demographics. How many students are you going to have? When I show you the demographic slide, you're going to see those numbers going up. Now, the bad news, good news and bad news. Good news is you are growing. You've grown even during the recession. The other good news is it's not going to continue forever. So when you look at those lines, you're first tempted to say, oh, we've got to expand. To a point. There is some expansion needed, but in the long term, those numbers are going to begin to level out. The district is reaching a point where it's starting to be built out. We looked at the utilization, how the number of spaces you have for teaching and learning, and how much they're used in each building. We made a series of presentations with Dr. Collins. Charlie went to each one of the communities and gave this similar presentation to each one of the villages to make sure that the public had an initial opportunity and the villages knew what was going on. We looked at special schools, and then we get into the final part, the recommendations. And number 12, the master plan facilities summary, is the part that we're just putting together now and we just inserted tonight. It's great to have a plan. The master plan tells you where do you want to be. That item number 11 is the strategic element. How do you get there? And we think that those two elements are important in a plan. It's one thing to say, gee, this is what we want to do, but unless you have the roadmap for how you're going to achieve that, you only have half the story. And volume 2 is the big thick part. That's got all the background information, and for anybody who's interested, there's literally hundreds of pages to look at of supporting documentation. This really began shortly after Dr. Collins arrived. With the support of the board, a strategic planning exercise was held, and this is one of the elements that came out of that strategic planning exercise, was to do a master facilities plan and really understand what your needs are and what the needs are going forward. We looked at the existing attendance areas for the elementary schools and middle schools just to get a feel for, again, the utilization, where the students are coming from, and where they're likely to come from in the future. We looked at the needs in terms of capacity, and you can see that a couple of things here. The chart up at the top talks about how many square feet there are per student. So if you look at, for instance, the second one down, Beach Elementary School. Currently, if you take the number of students in there and divide that into the space, it's 66 square feet per student. Nationwide, the average is 131 square feet per student. For elementary schools, 164, 65 for middle schools, and about 190. So you can see that just from a space standpoint, the schools are crowded. There isn't quite the space per square foot that you would expect to see in a 21st century learning environment. And at the far right there, the difference is an average of 87 square feet less than the national averages from kindergarten right on through 12th grade. There's been some deferred maintenance, finances, thanks to the leadership of the board. We're I feel on the right track, and starting to look at those things that had to be deferred for a while due to financial reasons. But there's different areas that we feel need to be looked at. We'll talk more about that in just a second. This talks about the enrollment, again, the number of students per classroom. I would draw your attention to probably that far right column, which is the utilization in the past school year, the 2010-2011 school year. And you can see that the Early Education Center, 109% of capacity. A couple of the elementary schools in the 90s, Raymond Ellis, Indian Hill, 105. Really gets tight when you get to the middle schools. They average 103, and the high schools where the real pinch point is. We're at 144, almost 145% of capacity here in the high school. District-wide, considering all the schools, 108.9% of capacity. So we're making good use of the space we have as far as the number of children that are being educated. This is the chart I was talking about enrollment. I want to make sure I respect your time. The blue line to the left is the historic enrollment going up to 2010-2011, the past school year. You can see how that continued to increase. It did flatten out a little bit last year, but 2008, 2009 continued to increase despite the recession. The lines to the right are different scenarios. The red being the one that we think is most likely to occur. Not much growth the next year or two, but then a renewed growth as the recession begins to end. Even if the low, what we're calling the low scenario, is followed, which really protracts, and we certainly hope not, protracts the recession out several years into the future, more than most economists are saying it'll take to rebound. Ultimately, in the year 2020, we're still up at about 8,000 students district-wide. So again, renewed growth, continued growth, but then after 2020, it begins to level off. We do have some limited resources. The district, as I mentioned early on, is pretty well beginning to be built out. It's nearing its maximum build out. There's still some undeveloped areas that are available, but not a lot. And of course, finances. Don't have to tell anybody in this room. You have to pick up a paper or turn on the TV or get on the internet to know the impact of the current recession. It's striking everybody, and school budgets are certainly no exception to that. So one of the things that we really looked at, and I want to draw your attention to the bottom line of that, needs versus wants. As we met with the board early on, they were quite clear that we had to look at those things that were really needed, those things that you want to do. So we really broke it down into three categories: needs, wants, and would like to haves. There are some things that would be wonderful to have, but they may just have to wait a while until finances are such that they can be achieved. The needs are those things that you just have to do to provide safe, warm, secure schools, good learning environments for the students. Working with the board and Dr. Collins and the administrators, we came up with this list of priorities. Again, the number one priority, as it should be, safety and security for the students. I think that goes without question. Number two, you saw it on the chart there about capacity. In our opinion, clearly the need is to address the overcrowding at the high school. That's the next priority. Number three, operational cost measures. There are things that we can do as far as energy cost savings at some of the schools that would translate into dollars. Instead of going to the utility company, we could put those dollars back into the budget and use it for education. So we think that's another priority. Number four would be the middle school. I know we have a brand new middle school, but the middle schools are already somewhat crowded, and we think that should be the fourth priority. The elementary schools have less capacity problems, so they're the fifth. And then you go to the should-have items. You know, the safety and security and those other things, those are the needs. The should-have items that need to be done. And then there's some other facility needs and the want-to-have items. And these are all detailed in the report. To respect your time, I'm not going to go through every single item with you. But breaking down the recommendations, we have some facility changes on the left, some physical things that we think ought to be done, and on the right are some non-facility changes that ought to be at least considered. Some of them may be not popular, but out of respect for the taxpayers, for the students, for all the stakeholders, we think all of these should be at least considered, and still rest with the board as to what ultimately is going to be adopted and implemented. So on the facility changes, energy audits at Indian Hill, at the Round Lake Middle School, McGee Middle School, and the high school. An energy audit is a more detailed study. We've done energy benchmarking. We've gone through every building. We've looked at how the energy usage of the building, compared it to things like EPA Target Finder, which is the estimated amount of usage for schools in our climate in this area, and seeing how the buildings fall. These four definitely ought to take warrant a closer look, and that's an energy audit. And we estimate that there's potential savings of between $90,000 and $180,000 a year from implementing some energy control measures in those schools. To address the high school, we think it ought to be done, we're suggesting that it be done in phases. It's a large project, and it just can't be done. It'd be wonderful if we had an unlimited budget to do it all, and to come in and do what has to be done in one fell swoop, but we just can't do it all in one. So we've broken it up into phases, beginning with a freshman center and commons to create more space by having freshman classrooms, setting that a little bit aside from the rest of the area to allow freshmen to acclimate to the high school environment. Then look at the music wing, the locker rooms, the connection between this part of the building and the main building, and those corridors. Third phase would be to look at the senior wing and the connections there, and the lunchroom, and upgrade that area. And finally, the 10th and 11th grade wing and the health center. Now, this is all subject to moving around. We built the health center, and we're going to have a presentation on that in a few minutes. So this isn't the final version, but these are the elements that we feel need to be addressed at the high school. Then again, the middle schools and the elementary schools in subsequent phases. As far as non-facility changes, those energy audits are things you do on paper, and there's also things you can do that don't require bricks and mortar changes as far as energy conservations, things like making sure that the HVAC system is programmed right, that lights are turned off. There are things that you can do that don't require a large expenditure of money, but just changes in operation. We put down year-round school. I know that's not, it's popular in some places, it's not in others, but one way to increase your capacity is to look at year-round schools as a way to make better use of the facilities that you have, and we feel it should at least be considered. And finally, you may have to redistrict, especially at the elementary level, as those schools begin to be crowded. We're seeing a disparity between the projected growth in some elementary districts versus others. You saw that not all the schools are overcrowded. We feel that that gap is going to widen. It's tough. When my oldest son was in elementary school, he was redistricted into another area. So I know, personally how tough it is. People go to a school, they think their child is going to be there through the whole elementary district. That is never a popular option. We realize that. But again, in the interest of all the taxpayers, all the stakeholders, and the children, it's something that may have to be considered going forward as we begin to see more crowding, especially at the elementary level. And with that, I know we're going to have, I think I kept it pretty much to 15 minutes. We're going to have questions and answers. Do you want some now, or
Why don't we
do you have a
let
presentation?
Brenda come, and
Sure.
all of this deals with facilities, so thank you, Brenda Banner.
Yep.
Okay. All right, now that we've got that technology out of the way. As Dr. Collins said, my name is Brenda Banner. My background is I actually was, in my past life, a high school teacher, and then also a healthcare professional. For the past 15 years, I have been working with school-based health centers, which essentially marries both of those two worlds, education and health. I've created across Illinois about 15 school-based health centers. And I have to say that this process in Round Lake is really being done the right way. And as I listened to the presentation from the architect, it really is very much in line in terms of a lot of planning. And I've seen health centers being done where there's just, oh, well, we've decided we want a school-based health center, let's just put one in. And that's just not the right way to do it. And so we've been spending a lot of time and will be spending a lot of time planning and what this should look like. I was asked in January of 2011, we received money from the Healthcare Foundation of Northern Lake County to look at the possibility of creating a school-based health center here. And so really what we needed to do was a feasibility study. And when we did the feasibility study, there were two real issues. One issue is there a need? Because again, I've seen school-based health centers being put in communities where there's not a need, and then you build the school-based health center and, oh, it's not utilized. What a surprise. The other is there an interest, is there a will in the community for this? Because there could, in fact, be a need, and if there isn't a will from the key stakeholders, then it's also not going to be utilized. So what we did was we pulled together an advisory committee that was made up of a large swath. There are about 12 people on the advisory board, made up of community members, of community representatives from community organizations, Dr. Collins, school board members, and also Kathy Myers from the high school, and also the health coordinator from the high school. So it was a wide group of people who actually guided and continue to guide this process. I looked at a lot of secondary data and also conducted focus groups and also one-on-one interviews. So we met with parents, Hispanic parents, parents from the middle school to find out what the needs were. And the secondary data underscored by the interview shows that there is a large need here. The number of low-income students continues to rise in the district, and the number of available practitioners is very low here. For example, when I talked to a group of parents, they talked a lot about how they were unable to find practitioners here to take care of their kids, and many of them talked about traveling to the city, traveling to Melrose Park, and also just how difficult it was, even if they had a doctor here to get an appointment. One parent, for example, talked about how her son wanted to join a sports team. She needed to have a sports physical. The wait was so long that to get an appointment, that she in fact missed the deadline for her child to have to get the sports physical in, and was then unable to join the sports team. So clearly, there is a need here in the community, and there's an interest in the community as well to bring the services here. What we did was we presented the report to the Board of Education. We also presented the report to the board of the Lake County Health Department, because they are interested in being the provider of the school-based health center. Both of the boards not approved the school-based health center, but approved that we move into the next phase, which is planning. So let me just take a step back and talk about what a school-based health center actually is. A school-based health center is essentially a physician's office inside the school. Comprehensive services that essentially are provided by a nurse practitioner. Usually there's a social worker, there's a medical assistant. So really it is like going to your doctor's office, but it's inside the school. Students who come to the health center are required to have a signed parental consent form. Okay, that's a critical piece. As I said, providing a comprehensive range of services, physical services, also behavioral health. And what we have found in a lot of the school-based health centers that I've worked in, the number one diagnosis is mental health. What happens oftentimes is a student might come in and see the nurse practitioner and say, oh, I've got a stomach ache, I'm really not feeling well. When the nurse practitioner talks to the student, they realize there's something else going on. Maybe it really isn't a stomach ache, or the stomach ache is really something that they just couldn't talk about, didn't want to come in and say, I have a mental health problem, or I've got a problem at home. And so it's very seamless because there's a social worker in the school, in the health center, and a nurse practitioner. The nurse practitioner can walk the student over to the mental health worker and can in fact then see the kid and discuss some of the issues. Students are provided services regardless of the ability to pay. And as I said, there's a nurse practitioner, registered nurses. And the last piece is the health center staff supplement, not supplant existing school staff. So this is not something that's going to get rid of the school nurse or get rid of the existing social workers. It's to supplement it. Now, this is, as I said, a doctor's office in a school. It is separate from the school, and it is run not by the school, but it's run by an external entity that works in collaboration with the school. So in the case of Round Lake, the interest is that this would be run, in fact, by the Lake County Health Department. So all of the staff would, in fact, be staff of the Round Lake, of the health department. So what are the benefits? Improves access to care. Most important, that it ensures that kids are healthy and ready to learn. We all know that if a student comes in and they have a headache, they have a mental health problem, they have a toothache, they can't attend in class anyhow. So it promotes student well-being and academic success. Also helps kids make healthy life choices. Decreases absenteeism. There's been studies that show absenteeism and truancy have been reduced by having school-based health centers in a school. And it decreases school exclusion because of state-mandated physicals and immunizations. I think October was the deadline for excluding kids. So if kids don't have their physicals and immunizations. In the schools that I worked in, they've had 99 to almost 100% compliance with physicals and immunizations as a result of the health center. Reduces healthcare disparities. It also teaches students how to appropriately use the healthcare system. So it's not like students can say, oh, I've got a headache, I'm running down to the school-based health center. They need to make an appointment, and they will learn what's appropriate and not appropriate. It reduces emergency room visits. Okay, so parents can, if a kid is sick, they can say, go see the health center. Decreases hospitalizations, and also decreases parents' lost wages. That parents don't have to miss work to take their child to the doctor. They can actually have them be seen at the school-based health center. Here's some important assumptions. As we heard earlier, we all know that finances is a huge issue. No school or tax dollars are used to operate the school-based health center. As I said, it would be run by the Lake County Health Department. The Lake County Health Department and the partners that they have would assume all responsibility for running that school-based health center. The only thing that the school would provide is space. And in terms of space, we would not expect the school to pay for the construction. This is something that, as a committee, we are looking to find funds, and there's actually a federal grant that's going to be coming out in the next several months, specifically for building school-based health centers, and so we will be applying for that. So no dollars would come out of the school budget at all. Having the school-based health center, as I said, is dependent on securing adequate funds. So it won't go forward if we don't have the funds to do this. It will not be open. We're not talking about opening this until the earliest, the 2013 school year. And part of this is because of all of the planning. Obviously, construction would take some time, but also we need to know what this school-based health center is going to look like. There are almost 2,000 school-based health centers in the country, and each one of them looks somewhat different based on what the community needs are and the wants of the community. The school-based health center will grow slowly and intentionally. We're hoping to have it in the high school. Initially, it will just be high school kids that will be seen, and kids who have chronic issues. Then it would grow to the other schools, and then possibly one day to the community. But this is very slow and intentional. You got to make sure that it works where it is before you open it up to a larger population. And it will be operated as a collaborative. And here's just a schematic of, we've already finished phase 1, the feasibility study, the pre-planning. We are in the planning now. What we intend to do here is we're going to be going out into the community, talking to people, explaining what the health center is, answering questions. We're going to be holding some more focus groups, doing some more surveys to get adequate information to make, as I said, this look like the community wants it to look like. We're hoping to get some dollars to support a nurse practitioner who might be able to work at the high school assisting the healthcare coordinator here that would be next year, and then launch in August of 2013. Okay, Dr. Collins.
We're now ready to take any questions you may have, any comments. I really want to thank our presenters for sharing information on where we are as far as our facilities are concerned and what is scheduled to happen as far as our growth and our concerns regarding the impact on our facilities because of the growth, and then also the idea of the school-based health center. And just that the community members and the initial information we have received indicates that there is a need for this in our community. And so we are glad that you are here this evening and want to take this opportunity to have you ask questions and provide any comments that you have about anything that you have heard this evening. And Heather will assist us in bringing the microphone around, and we simply ask that you identify yourself and your address and then ask away.
Jeff Lawrenson, 224 Stone Raleigh Park. You have safety and security of the schools. Murphy School has been spray painted several times this year. There's hardly any lighting in the back of the school. Is it possible, or can you address putting security cameras at the back of that school to secure the school at night when the school is closed?
Definitely, safety and security is of great interest to the school district, and we have, and this is something that is an ongoing process that we take a look at, what our needs are and how we need to proceed. The facilities plan that we're talking about is a more global plan, but we take a look at on a regular basis as we become aware. And I know that we have our buildings and grounds director here with us this evening who definitely tries to get rid of any graffiti that we see on any of our schools as soon as possible, so that it's not remaining in the buildings for a long period of time. Probably when we take a look at the needs regarding security or what we could use at all of our schools, we could probably use a number of cameras, et cetera, in a number of locations. So we consistently and constantly assess what the needs are with all of the buildings, and I do know that there is a need there, and there are probably some needs in other buildings. And so these are issues and concerns that we want to constantly take a look at. Charlie?
We just installed 2 lights on the back of the building about 2 weeks ago.
Okay, Charlie indicated that we just installed 2 lights on the back of the building a couple of weeks ago. Okay, thank you.
My name is David Gadzicki, 868 Nippersink. I'm hoping that the changes in this the health program is not going to cost me any money at all whatsoever. I understand there's like $850,000 of TIF money coming our way. and the school board is also looking to raise their taxes 1.8% or whatever they can legally raise it, to my understanding. With the healthcare center taking room up in the school here, I want you to know my student cannot attend the school of her preference. 3/4 of a mile away, we live from John T. McGee. We're traveling 4 miles to drive our school Round Lake Middle School. Why? Because of the has and has-nots. My daughter's either white and she can't go to her school of choice, or she's not Hispanic and she can't go to her school of choice. I'm not sure what Dr. Collins meant by, the has and has-nots. My daughter cannot attend a math class of her choice in Round Lake Middle School, getting a 98%, 90-something% in math. Her favorite subject's math. She comes home every day learning the same thing, saying, "Dad, I need another challenge." So she's brought home worksheets from the accelerated class that we are at home supplementing her education. Your children, check their grades in the Round Lake Middle School. They may be getting an A, but why aren't they driven to a higher standard? Why aren't they given the same opportunity to learn as the other children? Talking about adding on to schools and adding a healthcare center. My daughter, she's in village school, great school, love the school, love the administration. They don't have an art class. The PTO has to raise money so they can have a PTO, so that they can have an art class in the village school. Your dollars are going for a healthcare center. Why? I don't know. For pregnant kids, I don't know. Whatever the reason may be. But challenge some of this stuff. Don't just accept it at face value. The school system, if the healthcare thing, can't get a physical, rent a doctor for a day, give him $40 a student and have him do as many physicals as he can between these hours. I think we can do this a little bit differently. I don't think we need a healthcare system in here. Why? And also, one last thing. Please, anything Dr. Collins tells you, I advise you, if you want to take her word on it, ask her for it in writing. She won't remember it.
Hi, my name is Guy Finley, 399 Lakewood Terrace in Round Lake. I want to thank the board for a lot of improvements that you have done to the website, having board books online. All these materials were available to be downloaded, which was awesome. So I could go over that and look at it before this meeting even occurred. I would encourage you to keep doing things in that vein, the social media, Facebook. Sometimes I know more about District 200 than I know about my own district because they're on Facebook and they're posting updates on what they're doing. They've been down in Springfield to try to make sure Sears isn't going to take tax money away from them. I know that because they're on Facebook. So I encourage you to do that. I'm glad that the architects here talked about needs and wants, and I just want to add one more section to that, and that would be must. Going on almost 6 years ago, this district passed a $21 million bond referendum that said you were going to build an addition to this high school. That has not happened. Now, I know why that happened. It's because of McGee cost overruns. But you haven't explained to the community how that happened. And you want to come back and put in a health center, I don't know where, in a building that's at 145% capacity right now. I really wish that the board would focus on what the musts are and what the needs are, and not what the pie in the sky would be nice if we could have as wants are, because you just had $600,000, $700,000 of debt service come off because the bond for Johnson Controls is gone. You just had $1 million a year you were paying to Net 56. I'm proud to be the one no vote on that. They're finally gone now. You're not paying them $1 million a year anymore. So the district has opportunities to use general debt obligation bonds or other funding devices to come out and get this done, because you told us you were going to build an addition to this building. It hasn't been done. The people in this town raised their taxes after their taxes had already been raised when the tax cap was reset. So you really need to focus on this project for the high school because it's not a need, it's a must. In fact, I'm kind of surprised no bond attorneys have looked at it yet because here we are 6 years later, not one shovel has been put in the ground to do anything to this high school. We put a bunch of trailers back there. We have a football field that's better suited for cows than it is for one of the best soccer programs in this whole state. There's a lot of things that need to be done. I hope you focus on those and not the wants, the things that would be nice to have. Thanks.
Thank you, Mr. Finley. The one thing I wanted to say is that we as a board committed to hearing the good, the bad, and the ugly, and that's why we're here. And you know, it's not always going to be easy, so but we value your input. One of the things that we plan on doing is trying to use debt that's retired, because Mr. Finley, you're right. I mean, 05, 06, we had 2 referendums back to back. We raised property taxes because the state said you must to pay off your tax anticipation warrants and then the Andrew McGee. So we're cognizant of that. So we're really thinking everything over, like you said, debt that's been retired, but we really don't want to increase anybody's taxes by going to referendum or asking for any other property tax money. But that means that we're going to have to do it slowly and prudently. But you're right, the focus has to be the main priorities.
And I just want to, and here again, I wasn't here at that time, but just really want to say that when the board had the discussion in identifying what the priorities were, and we saw that the high school was right after safety and security, the high school was next in line. And I think that the board is very much cognizant of promises that were made and of the importance of addressing our high school, and that is a priority, and that conversation is continuous and ongoing as we move forward.
Hi, my name is Petra Salgado. I'm agree with the people who talked before me. Yeah, we need more space in the high school. The kids, I have 6 kids, and so far, 4 are graduated already. So I just need 1 year more to go to my baby. So I don't need. It's hard for me to come to this meeting because I only have 1 year more for my daughter. So I think, yeah, we need more space. Also, like the gentleman said, my daughter is also good at math, but we need more teachers who can teach them right to the college level. I have 3 kids right now in college, and they have suffered to get to those grades to be able to go to college. So I think we need more good teachers, more they can take care of kids, not because of the money, they pay back. So yes, I'm agree. I don't know what's the point to bring. Everything is needed, but I think the most important is education. And we need more good education in Round Lake.
Thank you.
I appreciate what you're saying about student education and student achievement, and I want to assure everyone in this room that not a meeting goes by in this Board of Education where we do not talk about student achievement. Just understand it can't be done overnight, and we encourage those of you that are here to please come to our Board of Education meetings. Be there and watch our schools present. Watch what we're doing in regards to student achievement. It's not going to happen overnight, but I assure you that we talk about it on a daily basis. And the school-based health center, if you recall what Brenda Banner said, this is not coming out of school funding. We are not going to take away from our expansion plans for the high school. We are looking at grant money specifically for school-based health centers. And if and when we get that grant and we add on to the school, we have already gone through many scenarios as to where we can put it and put additional space in the school that can be used for maybe additional administrative offices so that we can create some additional space in the school. This school-based health center is not going to take anything away from the much-needed space that we need in this high school.
Why not have them open up externally outside of the high school, right on Cedar Lake Road? Why not, why have them attached to the high school? Why associated with the high school?
Brenda, can I ask you to take that? She's got a mic. This is not the school that's making these decisions. This is the school-based health center committee. There are school board members, there are school personnel on that committee, but that committee is being run externally.
Right, yeah, and thank you for underscoring that. No, and if you recall the assumptions, if money doesn't come externally for the school-based health center, it's not going to move forward. So it's not like this is going to happen whether or not we get dollars. If we don't get external dollars, it won't happen. In terms of a couple of things, why it's better to have it, why not just have it on Cedar Lake Road? A lot of the research shows that having it in the school, when you ask kids, particularly high school kids, to make an appointment that's outside, oftentimes they don't go, they don't make it. And so having it in the school makes it very seamless. They don't have to miss class, they don't have to miss school. They can do it, they can come during their lunch period, they can come before or after school, and it really helps them stay in school. The other thing in terms of what you said earlier about paying money for a doctor to come in, having a physical by a random doctor that comes in that you aren't able to have follow-up is really not the best quality of care for kids. You really want them to have a physical, a sports physical, and we all know how important now having really good sports physicals are with all the information on concussions and heart issues, is that you want that doctor or nurse practitioner to be able to follow up on the student. So it isn't just some stranger coming in and doing a physical.
They don't follow up on it. You go get paid $25, you get a physical, and you play your sport.
I would also like you to consider the health and safety issue, that a child is going to feel a lot safer coming into a school where they know the people, they know the physicians, and possibly know the social worker that are going to be working with them. So I think it also goes back to the health and making our kids feel safe.
My name is Lisa Steffen. I'm a teacher at the high school. My address is 418 Haywood Drive. In regards, I have a lot of questions I wrote down, so work with me here. But in regards to the health center, being a high school teacher, I can tell you that it sounds like an awesome idea to me. The kids that are constantly truant claim they're sick. It would be wonderful if they could go here. Kids that I see that have emotional concerns where I'm worried about them, knowing that there's a clinic right there that I can go to and say I'm worried about this kid is awesome. But my number one question about that is sustainability. If Lake County doesn't, they give us the money, we don't pay a dime, and they build us a clinic and they bring in doctors and nurses, and then 3 years down the road, there's suddenly no funding, does that room or portion of the building become part of the high school now? Or, you know what I mean? That's my biggest concern, because if it is through grant money, I understand grants being in education, but what's the sustainability piece? Yes.
Well, and that's a really good question, and sustainability is something that we address right from the start, and you're absolutely right. It's not about space, too. You don't want to make promises to a community and then have to shut that down. The grant money that we're talking about is only for the build-out. That's for getting the build-out and all the equipment. The Lake County, and the reason that we're going to the Lake County Health Department is because they're what's called a federally qualified health center, and they are able to get enhanced reimbursements through Medicaid. So students are seen regardless of the ability to pay, but there will be billing done. And so the health center will be able to recoup dollars through billing. So that's all been included. We're not asking the federal government to constantly be funding. It's going to be it'll be like they're sustaining their own health centers.
Just to answer on the sustainability, to kind of show you how prudent the board is being, We just turned down a grant for an early childhood center that we really all wanted because we do need it. But the sustainability part was, it was iffy. And again, we said if our priority is the high school and this is not a stable funding source after 10 years, what happens and would it be prudent? And as much as it killed us, we said no. So it is important.
All right, where do I go? All my questions, Jen, my son's at Village, but I'm definitely mostly concerned at the high school, just when you look at those capacity pieces. But I'm wondering for the architects, and maybe I missed it on the slide, but we didn't really go into a lot of detail, but was there consideration for additional gymnasium space at all? Or not? Because my concern there is our PE classes are at 40 to 50 kids a class with 2 teachers in a gym, so there's up to 80 to 100 kids with 2 teachers and 1 gym. And if safety and security is number 1, it kind of scares me. It's the worst place in the world to get a subbing slip. Oh, go sub in PE. No.
The short answer is yes.
Okay.
It was consideration. However, we really felt that the primary need is academic. Not that there isn't academics associated with PE classes, but that the primary need was for additional academic space, and that's where the focus is. That's where we're talking about the freshman center.
Right.
Primarily
I
academic.
mean, I guess I would definitely agree academic is huge, but if number 1 is safety and security, that really is concerning to me as a teacher. I mean, it's scary to be in that gym. I would recommend walking in there one day, because it's tough.
I think it was the 3rd step of using. Actually, that was a renovation of this whole area, including the gym.
Okay, because I mean, that's just huge. There really needs to be some consideration for additional gymnasium space, because it is a major safety concern. Did you want to add to that, Sue?
Yeah, I'd like to piggyback on that. As a parent, it's not handicap accessible. All of our gym space is not accessible for our handicapped children. So that really limits it, especially as a safety matter. As education, I mean, we're just making my son feel to still take the classes he needed. But there's other things that could have been done. Upper body, if you're in a wheelchair, you still have the top of your body that you use. We're not going to have that to us. Oh, I thought it was loud enough. I have my plate on. So that is my concern as a parent. Done more time. I got more. I was just curious how year-round school helps out with capacity. Would the students go in shifts or what's, because I've seen models for year-round school. I actually like the idea. I know a lot of people probably don't, but I'm just curious how that would help capacity-wise.
There's various models of year-round school. People think that just because you go to year-round school, basically you have school for 9 months, you're off for 3 months, so that's a quarter of the year. You automatically increase your capacity by 25%. Doesn't quite work that way. Year-round school has inherent into it the need for additional storage. Teacher materials, when they're off, they need to be stored when another teacher is using that space. So just because something is year-round doesn't mean it automatically increases the capacity 25%. It does, by using the school year-round, it does increase the capacity. The problem you run into is just more family-oriented. We've got different models, and I won't bore everybody with all the different models, but you run into a problem with vacations.
Childcare, vacation.
Childcare, I mean, exactly. There's a whole bunch of other ramifications, but it is a way, a non-bricks and mortar way, to fit more students in and provide a greater teaching space in the existing facilities.
Okay. So are there a couple different models that you guys are considering then for year-round school, or is it just a possibility to consider at this point?
The one we just finished working on was from Raleigh, North Carolina, and they've got a couple of different models, and we add those in the appendix for people to consider.
I think also, as the presentation was being made, and I think one of the things that we want to pay particular attention to is that we know that from now until approximately 2020 or 2021 that we're going to be growing. And we know that we have got to find some solutions. And if we don't have the dollars to do some of the building or making the changes, what are some other options, or how do we think creatively? And so this idea of year-round schooling is something else that we would need to delve more into and take a look at. We know also when you talk about using a building 12 months a year, we have air conditioning needs. And we know that we have some air conditioning concerns here at the high school. So these are some ideas that are out there. We know that we will have more students that we need to accommodate as time moves on. And so what are some ideas as to how we can accommodate them? So that is an idea, and not something that we have explored in depth, but just knowing that that's one of many.
All right, what else? Why, for the high school, I'm curious why the phases were done by grade level. I understand the concept of a freshman academy, and that is a great idea, but I guess I'm confused as to how you're envisioning the school. Because right now, I think you know, it's broken more departmentally, and I'm curious what the thought is.
I should have brought the diagram that Greg Lundberg put together to explain the various phases. It's done more just for the physical infrastructure of the building. There was areas that we identified primarily being used now for in the park and for the high school, for the seniors, et cetera. It was more, how do you phase the construction?
Right.
As Dr. Collins, some of the board members mentioned, to work this within resources without having to go to a referendum, without having to raise taxes.
Right.
How can we do it in a
More
logical
of a
sequence?
four-phase plan rather than necessarily grade.
Sure, it'd be nice to do it all at once, but
Okay. What was the cost difference between building a new high school and then remodeling here? Did you, I'm assuming you guys looked at that?
we did look at it, but the facility cost, we looked at all the components that needed to be upgraded and compared those to building new. The general rule of thumb, and it varies from community to community, state to state, nationwide, 66% or more. In other words, if it costs 66% or more of building, the cost of building a new building, a lot of states recommend that you build a new building. But none of the improvements here, as far as the infrastructure, exceeded that number.
Okay.
So it just didn't seem to make economic sense to us to abandon some good bones that need some upgrades in favor. Sure, it would be easier to build a new building, there's no doubt about it.
Right. And then the only other question, I think, was regarding technology in all of the schools, I guess more specifically the high school, but what were they planning for, like computer labs or access to technology in the classrooms? Is there talk of smart boards at all? I know that might be a want.
Let me just sort of start responding because, you know, it's interesting. We just had during cabinet meeting this morning, Scott did a presentation to the cabinet that he's tweaking for the board during the month of December. And it was in the area of technology. So we are taking a look at, as we're making some transitions and really talking about our infrastructure, et cetera, servers and everything else, and just some of the nuts and bolts of technology within the district, and where is it that we want to go. And we know that there will be a second presentation, which will follow the one that Scott will be presenting, who is our Director of Technology, which is focused on instruction. And not only focused on instruction, but also the technology within our offices, et cetera, and what is our plan as we move forward, and where do we want to be. We know what our strategic plan says, we know what our mission as well as our vision, and we know that we want to, in order for our children to be successful, we have to have a 21st century learning environment. And so how do we go about creating that? Here again, taking into consideration the cost factor, just as we talked about our facilities, and what is it that we need to do as far as phasing in. So those conversations are taking place, and we know that it's something that we've got to get up to speed with and move along much more quickly than what we have in the past.
And I just wanted to say so everybody knows that we are being systematic about it. The meetings, our agendas on most of our meetings are very long. So with the board's wisdom, we decided to have a finance committee so we could drill down for an hour and a half before every board meeting and look at the good, the bad, the ugly of proposals, and then bring it back to the board for recommendations for their final approval. So we're going to that extent so we can even brainstorm on do we use the buildings where the administrators are at, move them somewhere else so we can move students in there quickly and relieve them of the problem. So we're really trying to think outside the box short term, and then long term, it gives us more time to look at financing.
And just even going back to, the question was brought up about Facebook and just Twitter and a number of other resources and technologies that exist in other districts. And I'm sure that there's probably not anyone who I work very closely with who has not heard me talk about the need for us to start moving in that direction. There are a lot of things that we need to do as far as technology is concerned, and as we attempt to improve our communication. And those are areas that we want to go into, and we are taking a look at, even as we are now looking at improving our website, and so that we have the capacity to do more than what we have done in the past. So all of these communication pieces, we're very concerned about. We know that we need to move farther along at a quicker pace in communicating both internally as well as externally, and that goes to technology. It goes to what we need to be doing at the various building levels as well as district-wide.
Also in regards to that, the school board attended the Illinois Association of School Board Convention last weekend, and I know that one of our school board members, Kevin Daniels, focused specifically on social media in the sessions that he attended, and brought back a lot of really good information. And I'm not sure if it's going to be the next school board meeting or the one following. We will all talk a little bit about what we got out of the school board conference. So if you want to hear a little bit more about some of the things we want to do or that we're looking at, you might want to come to one of the school board meetings.
I don't know, Kevin, do you want to say anything about what you attended at social media or not?
Oh.
I don't know, I don't want to put you on the spot.
That's okay.
I really do.
Pick on the new guy, huh? Social media is obviously growing like crazy. In a previous life as a professional marketer, it's the best way to reach people in a number of ways. And the baseball league I work with from time to time has gotten better and better at social media, and it just seems like the next logical step once we go through the transition that was mentioned with our website. It makes perfect sense for us to go to that. However, I would say it needs to be part of a larger communication plan in general. So we need to reach out to our constituents, our community out there, and find out how you'd like to be communicated with. And we'll draft a master plan about how we want to communicate all of the things from the district, from the board, from the individual buildings, and then work social media into that. You'll probably see Facebook following fairly quickly on the heels of our new website. Twitter may be a little bit further behind. Just a show of hands in the room, who is active on Facebook today? Okay. By the same, a show of hands, who is active on Twitter today? Okay, a lot less. So I'm active on both, and there are new social medias coming out every day. And of course, we use email and we use telephone to get the word out about events like tonight. And we hope that we continue to have a good, solid showing at the events we do sponsor. We will constantly work on revising our communication plan and strategies, because even when we do our board self-assessment, it's our highest priority as a board development among this group of 7 people to figure out how to communicate better with our constituents.
Hi, Joe Schumann, 35, 830 North Fairfield. The healthcare center, one of the questions I have, how do students pay for it when they go to do it, or is it free? And then what are the liabilities of the school district? I know they're saying it's separate, but if you have a mental issue with a student, and say the student were to hurt another student, what's the legal ramifications of the school district, because the health center's in the school district?
Well,
Well, first, in terms of payment, there's no, like I say, all students will be seen. No one will be turned away if they can't pay. But students who are on Medicaid Medicaid will be billed. And then if you have private insurance, the private insurance will also be billed. And there might be, and again, this depends on, this is part of the whole planning process, there may in fact be a sliding scale, but in most instances, a sliding scale is very small. You know, it might be $3 per visit.
Well, if I already have health insurance that I'm paying for, and you guys are gonna bill, is it at a special rate that you guys are gonna be billing at because there are more low income folks coming in to use it? Do I get paid, let's say I have to get a flu shot done. My son has to get a flu shot done, if you guys are gonna be doing that type of thing. Do I have to pay more for the flu shot than a person who's low income paying for a flu shot because they already have insurance, or it's all?
No, it's all right. It's the equivalent, as I say, that you go to your doctor. So if you go to your doctor, you're not paying more to go to your doctor for a flu shot than somebody who's on Medicaid either.
Is the health center expecting to do, let's say the whole football team needs to have a physical? Is health center going to be doing the physicals for the whole team and be responsible if there's something happens?
I'm sorry, I didn't hear what you said here.
If the health center's here, and let's say all football kids come in and have their physicals done here at the school, okay, and one of those kids has a heart murmur for whatever reason and passes out and dies on the field, okay, because it wasn't checked properly. Where's the responsibility for that in the school district? And if they're not actual doctors, how are they administering physicals to be able to do that?
Well, they are, depending on what's decided, it'll be a nurse practitioner who is working in collaboration with the physician. Well, depending on what's decided, it'll be a nurse practitioner who is working in collaboration with the physician. And it would be, what you have to understand is, it's as if it is in the school, but it is if the student is going to a physician. So if, God forbid, there is some problem that was overlooked in the physical, that the liability would travel the way that it would travel with the physician. The fact that it's in the school is not liable for that. And believe me, there's a lot, the attorneys are at work in terms of memorandum of understanding and agreement, so it's not something that's gone into lightly.
What about mental health situation? How would the school district not be responsible if you have that facility in the school district?
I'm sorry, we can't hear.
Yeah, Brenda, if you could repeat his question.
How is the school district not responsible for an issue if it's in the school district? You have a bill, any attorney, if it's in the school district and the diagnosis is made incorrectly, there's going to be a problem.
Well, in all my experience, that's never been the case. And again, we have memorandum of understanding where all of this is very much outlined in terms of liability, etc.
Okay. And I just wanted to piggyback on that Lake County Health Department has reduced their staff at Avon Township at their mental health clinics by 50%. So there's even a greater need now because the county's been back on public health care.
So if they're cutting back there, how are they going to stay at your school health center? I mean, they have a clinic 8 tenths of a mile down the road. So if they're cutting back staffing at that clinic, aren't they more or less just piggybacking on the school district and say, sure, build your clinic, we'll be happy to do that, and then we'll put somebody there for a year, and then when it gets defunded, out it goes, and you guys are going to be holding the bag then, not the county. You can say, well, it's the county, it's the county, it's the county, all you want. The community will think the high school, the school district shut down this clinic because they don't have the money.
I'm going to ask Brenda to respond. She has experience and has done this in a number of different places.
In the county, believe me, as you're talking about sustainability, the county is not entering into this lightly either, because they also don't want to open up a facility and put resources in a facility and then have to close it. So for them, we did a similar presentation in front of their board, and they were very careful. And again, they're looking at this planning phase. We're creating a very robust business plan for them to look at what this what this will look like in terms of sustainability. The other piece is that they're not doing it solo. We have a lot of other partners around the table. So Vista is at the table, Advocate Condell is at the table, and so everybody is looking at ways that they can also come to this. So Vista, which has a very large mental health, behavioral health program, is looking at the possibility of partnering with them as well. And I understand your concerns. Nobody wants to start this and be worried that it's not going to continue, but that is part of what we're doing, and that's why this planning is so critical.
Mr. Finley, so one of the things that Lake County said was that they would not partner with us if their cost increased. And we said we couldn't afford to construct it, so everybody's like, we can't increase the individual costs, but we'll partner if everything comes together.
I just have one more question. On the building portion, what security and safety are we, that was on the top of the list, what are we doing right now that needs to be addressed?
The question was, you heard the question. Primarily, those are life safety issues, ADA accessibility that was mentioned a minute ago. So anything that has to be done that was identified in the life safety report that hasn't already been done, or any new issues that have arisen since, I believe the last life safety report was done in 2003 or 6. I'm sorry. It was done several years ago. The district has been diligently working on correcting those. There's still some items to be left. So we took those items, put them at the top of the list, and if there was anything new that the architects, engineers, or planners noted as they went through the building, those were put on there as well.
What about security?
I'm sorry.
What about security?
I believe that was one of the items as well.
I think we have a young lady, someone over here in this section.
Sherry Byrne, 24716, Rollins Road, Round Lake. My questions are about the school-based clinics. Now, when one of our children come in to go to the clinic, are the parents notified that they've gone? Do we have any rights to know what you are doing with our children while they're in the clinic?
Generally speaking, no, parents are not notified when the students come in, though if they come in and they're getting medication, oftentimes they will be called, or if you have your own physician, oftentimes they will be in contact with your physicians. But no, as a rule, parents are not notified.
Well, how do you pay for medications?
Didn't you say that? Why are we doing that? That's what I thought too. I know.
Parents are, before your child is even seen, they have to have a parental consent on file. So you've given your permission for them to be seen. Generally speaking, when they come in, the parent is not called, though parental involvement is totally encouraged. I mean, that is a key cornerstone of the school-based health center, that they work in collaboration with the parent.
But what you're telling me is that if my daughter decides she doesn't want to tell me what's going on, she doesn't have to, and you can't. Is that correct?
In some instances, yes. However, as I say, students are encouraged to talk with their parents. Every effort is made.
But they don't have to.
I think that what I'm hearing Brenda say is that if a parent gives permission for their child to be seen there at the clinic, then the parent is also explained to the parent, and they understand what rights the student has and what rights the parent has. And so any parent who agrees for their child to be seen, they are agreeing to this type of arrangement between the clinic and the student.
I understand that, but say I give permission for my daughter to go in for an earache.
okay? And a couple years from now, say she decides she wants to have an abortion. Is that something that you will deal with without letting me know?
Amen.
Well, school-based health centers do nothing in terms of abortions. And as I said, students are encouraged to talk with their parents. But no, if your student comes in, if your child comes in and does meet with a provider, we can, then the student and your student does not, your child does not feel comfortable telling you, then we can't tell you. But the reality is that every effort is made to include the parents. No, by state law, right, by state law, all children 12 and over are able to see a physician without parental consent. So they could go to, your child could go, or someone's child could go to the Lake County Health Department or go to the hospital and be seen without your being told as well.
But not at our own high school with our tax dollars right here, though. That's the main problem. Yeah, they can go to the health center, the county and all, but they cannot walk on our tax dollars currently as it is to have an abortion. Does that mean you transport the student to the abortion center?
No, we have nothing to do with
No, I know you
abortions.
say you have nothing to do, but there's a connection there somewhere.
But she explained that none of our tax dollars are being paid for the clinic.
No, tax dollars are paid for help, but not from the
We have been doing a great
They let
job,
county tax-
and I really appreciate, gentlemen,
taxes on it.
that people are observing those who have the mic and that we're not just talking out during the forum. And I would ask that we continue the same protocol that has been observed up to this time. Thank you so much.
If you live in Lake County, you will be paying for it through your taxes. Is that not correct? You say you're going to them for grants and for money. We all pay Lake County taxes, therefore we are paying for it.
Yeah, and that's something that I can't answer. The grant dollars that are coming are federal grant dollars. In terms of, again, as I say, the money that will be used to sustain the health centers is money that will come to them through Medicaid, which is federal dollars, and also from private insurance. So to my knowledge, no Lake County tax money would be used because, again, they aren't going to do the project, as Doug was saying, unless it's going to be cost neutral for them. So none of your tax dollars will go for that.
Heather, we have a gentleman up there at the top.
I had a question, Robert Smith, 23 at the North Lane. Now, would this facility be open after school hours? Would this be facility after school hours?
At this point, we don't know. Again, this is can everybody hear me? This is the planning time, so we're going to be looking at what makes most sense for the community and for the school. Some school-based health centers are open early, some are open later in the day, and again, it depends on what makes most sense for your community.
So if it's open early or later, who pays for security and the lighting and the HVAC system to run that facility on your school property?
It wouldn't be open later than the regular hours of the school. I'm not talking about in the evening. It would be within the school parameters, but if you have after-school programs, it could go after school. And again, these are the kinds of questions that we need to talk about and to figure out in terms of your school and your community, what makes sense, what will make it cost neutral.
Now, you talked about each student will be charged or billed. If I say my son goes in to see the health administrator, whoever it is, or is it going to be a physician there? An actual doctor?
Actually, most of the school-based health centers are operated by nurse practitioners who are master trained nurses who always work in collaboration with the physician. They have a collaborative
physician will come, there's a medical director who will come and see students and work with the nurse at times. But essentially, the main provider is a nurse practitioner.
Okay, so will we be charged if my son decides to go there? Will he be charged?
Your insurance or Medicaid will be charged.
What if you're not in my network though?
For all students, the thing that's really nice is there's something in Illinois that's called Health Connect. So all students, regardless of what network they're in, can be seen at the school-based health center. Not adults, but students.
Students, okay.
I think it's important too that you remember, you do not have to sign permission for your child to use it. Before you give permission, you will have all the information that you need regarding the process with the health center. So you have the opportunity to learn everything there is about it before you give permission for your child to be a part of it.
And if I could just say one more thing, this is just, as I said, the first conversation in many conversations. And we hope to call together, as I said, focus groups, call together other community forums so that we can really have this conversation. Today's conversation is mostly focused on facilities. We want to really have conversations that are focused specifically on this, to hear your questions, hear your concerns, and to be able to answer them and address them. Yes.
Kevin McLean, 1608 Deer Pass Court, Mount Lake Beach. My major concern here was I didn't come prepared for any of this stuff, like this gentleman down here in the gray sweatshirt. I agree with a lot with almost everything he said, and I appreciate what he said. This health center thing is the thing, healthcare center is the greatest concern that I have tonight. I see it as one more step in the socialization of this country, and I don't like that. I don't like the socialization coming into the schools. I don't like that some doctor that I didn't choose for my child is seeing my child if that should happen. I don't like that children could be referred by the school nurse to the healthcare center at her discretion, with or without the parent's permission. And I don't like that the child doesn't, or somebody doesn't have to report to the parents. The parents have full responsibility for those children. They were born in that family, and they should be the ones that have full say-so. And again, I don't like socialization in this country. The redistricting of children from one school to another. I have very good friends who have to live within like 2 or 3 blocks of a school, and they're being redistricted clear across town. I think that's foolish. I think it's expensive. I think it's senseless, and I think the kids ought to go to the school that's closest to them, that makes it easiest for the parents and for the children to attend the school, and to reduce busing costs. I also have those same friends and other friends who are very disappointed with the scholastic challenges for the children, especially in the grade schools, that have yanked their kids out of the schools and are homeschooling them now because of the dumbing down and the lack of efforts to educate these kids, the lack of homework, and it's very disappointing to our family and to many others that I know, the way that the school systems have gone in recent years. I think the high school, for the most part, is doing a very good job, especially in the honors and AP classes. There are a lot of classes where the kids aren't challenged enough to even have homework to take home. I think that is a sad statement about our schooling. This funding that's been discussed so much about, it's not coming out of our pockets or out of the school budget or something like that. Again, the socialization is something that creeps in a teeny bit at a time. It's like the camel getting its nose into the tent. Eventually, it'll probably end up coming directly out of school funding, but regardless of whether it does or not, It's coming out of one pocket or the other of each one of us in order to provide this funding, because nobody gives it out for free. And whether it's Medicaid or Medicare or Social Security or just general welfare or billing or whatever, is coming out of tax dollars for the most part. Whatever isn't billed directly to the parents and to the insurance companies. And even if it's billed to an insurance company, it's coming out of somebody's pocket. So we need to be careful about what we're getting ourselves into, creeping into more socialization. It's a nasty thing, and I really don't like to see it coming into the schools. I haven't heard anything about any upcoming voting on this by the parents in the districts. I don't know if this is just something that this lady down here, who's the planner that pushes this stuff into school systems, and the board that decides on these things. I'm not sure what the process is, but I would sure like to see a community or a county or a state vote in order to put something like this into the schools.
Yes.
Beyond that, I guess I have nothing else to say.
We'll take one more question, and we're going to ask, we're scheduled to finish in 4 minutes, and then I'm going to ask you have a green sheet, which here again, as we talk about communications, we would ask that you complete this communications survey before you leave, and if you would leave it on the table there in the back, we would greatly appreciate it. And before we take our last question, I just want to thank everybody for coming out this evening. I thank you for your questions. I thank you for your comments and for your interest in our facilities, as well as our discussion regarding the school-based health center. Thanks to I see we have a number of administrators here in our audience also, and I want to thank them for coming out and being available this evening, and to also hear what our community members wanted to share with us. And thanks to our board members who give so much time on behalf of District 116. And so just really wanted to take the time to say thank you before we entertain our last comment or question. So thank you so much, appreciate it.
And I would also like to do the same, and I know that maybe some of you didn't hear exactly what you wanted to hear tonight, but I do want to assure you that this Board of Education has heard what you said. We will take what you're saying into consideration. All of this is still in a planning stage, and so we do need to hear from you, and I encourage you to continue to come to these forums, continue to come to school board meetings, so that we don't make decisions without hearing what you have to say. I appreciate you taking your time out of your evening to come and support your school and support your community.
Thank you. My name is Barry Gerby, live on Ridgewood Drive here around the lake. I have a question for the architect. I'm not sure if you guys have gotten this far yet, but where would you be planning to build at the high school? Are you planning to build out? Are you planning to build up? And if you are planning to build out, like what would you be sacrificing? Like a student parking lot? Would be athletic fields? What would be sacrificed?
Both. Oh, and the student, the ninth grade center would be in the back.
Where the mobiles are?
I believe so. And I should, that was, and I apologize to the board, that was my fault. I should have brought that drawing very quick together. Am I wrong?
Yeah.
Okay. That's why I'm a planner, not an architect. Something's gonna straighten
over by the vet parking lot.
By the student parking lot?
Yes.
Okay.
In that section out and up.
And just a couple of things I wanted to toss out, not necessarily need to answer, but when you do plan to build, obviously it's going to need money, and it sounds like you're going to have to go to referendum at some point to do all these things. And I think you need to start planning now on getting the trust of the community to pass that referendum, because as Mr. Finley said a few years back, we passed a $21 million referendum, and what you told us it was going to be spent on, not you personally, but you as a board, figuratively, it wasn't spent that way. You're gonna need to regain the trust of the community to get them to pass the referendum, especially now in these economic times. And also, when you go to build, when you do the health center, I ask that you be sensitive to the history of Round Lake, of the Round Lake schools. Some of us who've been here and been around, we've had health issues here, major problems. I wouldn't say problem, but just things that have happened that we need to be sensitive to. We need to look to our past, learn from our past, so that we can go forward in the future. Same thing when you're building that. There have been people here who have not been sensitive to the history of Round Lake, and it hurts those of us who've been around and community members who've been around a long time and their history is being washed away. Thank you for your time.
Thank you.
Nancy had asked if the schematic plan was available in the district office, and so we will see that we have that, and we will let you know when that is available so that you can access it. Again, thank you so much for coming out this evening. You're appreciated. Thank you.